Hello friends, in the previous video we mentioned a little about how we measure prothrombin time. What the lab guys will do is when you send the blood in a vacuum tube, with that blood they centrifuge it, get the plasma and they add the exact amount of tissue thromboplastin which is derived from human, rabbit or recombinant DNA, and they add it with the exact amount of calcium ion in the blood, incubate it in a well-controlled temperature and the blood starts to coagulate. So the lab guy take his stopwatch and start counting how long does it take the plasma to coagulate. They report it in seconds, says 10 seconds and hence the PT time is 10 seconds. If it's 20 seconds then the prothrombin time is 20 seconds, 30 seconds then the prothrombin time is said to be prolonged, 30 seconds, so on and so forth. So the prothrombin time measures factors like factor 1 which is fibrinogen, factor 2 prothrombin, factor 5, factor 7 and factor 10. But there is one problem. Yes, it lies in the tissue thromboplastin, which is a combination between the phospholipids and the tissue factor, which is derived from human brain, rabbit or recombinant DNA. This is a biological product which is an active intrinsic pathway. As you can see, there will be bound of variation between batches and manufacturers. So when you use tissue thromboplastin in batch A and you add calcium chloride into a test tube, it might take 10 seconds to clot the patient's blood. If you take another tissue thromboplastin from batch B and you add calcium chloride in the same set of patient, it might take, say, 13 seconds, and hence there's variation between batches of thromboplastin. So this dev in the early 1980s overcome this problem by inventing the INR. So what do he do to overcome this problem? So each batch of thromboplastin is assigned to the International Sensitivity Index, in which the manufacturer needs to calibrate their thromboplastin to this index when they manufacture it. Thromboplastin batches is assigned to 1 ISI, which is an International Sensitivity Index. Normally the ISI is between 1 or 2. The prothrombin time for a normal healthy patient or a control value is obtained. So the INR is the ratio between prothrombin time of the measured patient and the prothrombin time of the normal patient covered by the International Sensitivity Index. So for example, if the PT time of a patient is 26 seconds and the PT time of the normal healthy subject is 13 seconds, assuming the ISI of the thromboplastin batch is 1, so you get your INR of 2. So if you get the INR result for patient A in Hospital Kuala Lumpur lab, you can be certainly confident that you will obtain a similar INR for the same patient in another lab, says in USA. So this guy is so successful that the whole world is adopting INR. In fact, some labs don't even bother to report the prothrombin time when they report the INR level. Hope you enjoyed this video.